Today we're going to talk about hives, which is part of dermatology. Hives are itchy, raised welts that are found on the skin. A welt is a red raised mark or scar. They're usually red, pink, or flesh colored, and sometimes they sting or hurt. In most cases, hives are caused by an allergic reaction to a medication or food or a reaction to an irritant in the environment. In many cases, hives are an acute problem that may be alleviated with allergy medications. Most rashes go away on their own. However, chronic cases, as well as hives accompanied by a severe allergic reaction, are larger medical concerns. Hives are usually caused by an allergic reaction, as we said before, to something that you have encountered or swallowed. When you have an allergic reaction, your body begins to release histamines into your blood. Histamines are chemicals your body produces in an attempt to defend itself against infection and other outside intruders. Unfortunately, in some people, the histamines can cause swelling, itching, and many of the symptoms that are experienced with hives. In terms of allergens, hives can be caused by factors such as pollen, which is a fine powdery substance, typically yellow, consisting of microscopic grains discharged from a male cone. Each grain contains a male gamete that can fertilize the female ovule, to which pollen is transported by the wind and insects or other animals. Medications is also a cause. Food, animal dander, which is flakes of skin and animal's fur or hair, and insect bites. Hives might also be caused by circumstances besides allergies. It's not uncommon for people to experience hives as the result of stress, tight clothes, exercise, illness, or infections. It's also possible to develop hives as a result of excessive exposure to hot or cold temperatures or from irritation due to excessive sweating. People who are known to have allergies are more likely to get hives. You may also be at risk to develop hives if you are on medication or if you are unknowingly exposed to things you might be allergic to, such as food or pollen. If you are already ill with an infection or a health condition, you may be more vulnerable to developing hives. The most noticeable symptom associated with hives is the welts that appear on the skin. Welts may be red, but can also be the same color as your skin. They can be small and round, ring-shaped, or large and of a random shape. Hives are itchy, and they tend to appear in batches on the affected part of the body. They can grow larger, change shape, and spread. Hives may disappear or reappear over the course of the outbreak. Individual hives can last anywhere from half an hour to a day. Hives may turn white when pressed. Sometimes the hives may change shape or form together and create a larger raised area. Hives can occur in a variety of places on the body. Call 911 or seek medical attention immediately if you develop a hive outbreak around your throat or on your tongue, or have trouble breathing along with hives. The most common causes of hives are allergic reactions. This can be caused by allergens you might be sensitive to, including foods such as nuts, milk, and eggs, pet dander, pollen, dust mites, which is a type of animal specifically arachnid, insect bites or stings, medications, primarily antibiotics, cancer drugs, and ibuprofen, which is used for treating fever and inflammation. Mild cases of hives caused by allergies are typically due to long or short-term allergy medications and avoidance of the trigger. Anaphylaxis is a severe life-threatening allergic reaction. In this condition, hives are often accompanied with breathing difficulties, nausea, or vomiting, severe swelling, and dizziness. Call 911 immediately if you suspect anaphylaxis. Chronic hives are ongoing cases that don't necessarily have an identifiable cause. This condition is marked by recurring hives that can interfere with their lifestyle. These can last between 6 weeks and several months or years. You may suspect chronic hives if you have welts that don't go away within 6 weeks. While not life-threatening, this form of hives can be uncomfortable and difficult to treat. There may also be a symptom of an underlying health problems such as celiac disease, which is an immune disease in which people can't get gluten because it will damage their small intestine. Gluten is a mixture of proteins. Lupus, which is a disease that occurs when your body's immune system attacks your own tissues and organs. Type 1 diabetes. Rheumatoid arthritis, which is a long-term autoimmune disorder that primarily affects joints. And thyroid disease, which keeps your thyroid from making the right amount of hormones. This form of acute hives is considered mild, which is the dermatographism. Excessive scratching or continuous pressure on the skin causes it. Dermatographism usually clears up on its own in a short period of time without treatment. Sometimes changes in temperature can induce hives in people who are sensitive to such changes. Cold-induced hives may occur from cold water or air exposure. While body heat from physical activity may cause exercise-induced hive, exposure to sunlight or tanning beds may also bring about solar hives in some people. Both viral and bacterial infections can cause hives. Common bacterial infections causing hives include urinary tract infections and strep throat. Viruses that cause infections, mononucleosis, hepatitis, and often cause hives. The first step in getting treatment is to figure out if you actually have hives. In most cases, your doctor will be able to determine if you have hives from a physical exam. Your skin will show signs of the welts that are associated with hives. Your doctor may also perform blood tests or skin tests to determine what may have caused your hive, especially if they were the result of an allergic reaction. You may not need prescription treatment if you're experiencing a mild case of hives, not related to allergies or other health conditions. In these circumstances, your doctor may suggest that you seek temporary relief by taking antihistamines, which treat symptoms of allergies, avoiding irritating the area, avoiding hot water, which may aggravate the hives, taking a cool or lukewarm bath with colloidal oatmeal or baking soda, and anaphylaxis is a medical emergency that needs to be treated immediately by a physician, and shop for a baking soda. Simple changes to your lifestyle may be able to help you prevent hives from occurring in the future. If you have allergies and you know which substances are likely to cause an allergic reaction, your doctor will suggest that you avoid any possible exposure to these factors. Allergy shots are another option that may help you reduce the risk of experiencing hives again. Avoid being in high humidity areas or wearing tight clothing if you have recently had a hives outbreak. Although hives can be itchy and uncomfortable, usually they are not severe and will disappear after a period of time. However, be aware that as some hives go away, new ones may pop up. Mild cases of hives are considered harmless. Hives can be dangerous if you are having a serious allergic reaction and your throat is swelling. Prompt treatment for a severe case of hives is important to a good outlook. Hives is a rash in your body. Although hives are often associated with allergic reaction, they can also be triggered by stress, medications, insect bite or stings, sunlight, cold temperatures, infection, other underlying conditions. Identifying what triggered your rash is crucial. If you can identify the trigger, you can avoid contact with it and prevent more hives from forming. Hives generally fade within 24 hours and don't require treatment. However, you should seek immediate medical attention if you experience any of the following: dizziness, swelling in your throat or face, difficulty breathing. These may be signs of a severe allergic reaction and require medical attention and emergency care.
Okay. In some cases, home remedies are all you need to find relief. Here are a few ways to soothe your itchy skin. Um, hives are not that serious, so something that you can do at home can like solve the problem quickly. Um, the first thing that you can do to heal the hives is applying something cool to your skin can help relieve any irritation. To do this, grab a bag of frozen veggies or wrap a handful of ice in a towel and apply it to the affected area for up to 10 minutes. Repeat as needed throughout the day. Basically, cooling it relieves irritation and helps it go away quickly. Next slide. Another thing that you can do is take a bath with an anti-itch solution. There are several products you can add a bath to relieve itching. This include oatmeal, specifically marked as colloidal oatmeal for bathing, or 1 or 2 handfuls of baking soda. These things you can put on the spot, and it helps the healing process. The itching. Avoid certain products that may irritate the skin. So basically, you could remove the you could not irritate it. Certain soaps may dry your skin, cause more itching when you have hives. Make sure to use a soap that's marketed for sensitive skin. Find a great selection here. These typically omit fragrance and other irritating chemicals. You should also avoid using irritating moisturizers or lotions. When in doubt, opt for a formula that targets sensitive skin, such as these options. Applying immediately after bathing may help with the skin. Basically, um, use things that remove the itching and don't use things irritate and that irritate the skin. Something that can irritate the skin is some soaps and moisturizers. They can irritate the skin with the chemicals they have inside. So make sure that if you have hives, that you use soaps and moisturizers that are skin sensitive, so they don't irritate the skin. Keep things cool. Heat can make itchiness worse. Wear lightweight clothes and keep the temperature in your house cool and comfortable. Avoid sitting in direct sunlight. Basically, we talked about how um, the first thing that you can do as a home remedy is to cool the spot. You are making sure that the overall temperature and the overall conditions you are in are cool and not humid, because humidity can make things worse. Next slide. Okay, natural remedies. If home remedies aren't relieving your symptoms, but you aren't ready to head to the pharmacy, you may want to give a few natural solutions a try. Natural remedies typically aren't regulated or approved by the U.S. Food and Drug Administration, so use with caution. Next slide. Some natural remedy that you can use. One of them is witch hazel. The natural tannins found in the herb witch hazel can help relieve irritation. You may want to prepare your witch hazel mixture to use as an astringent to maximize the tannin. To do this, add 5 to 10 grams of witch hazel bark to 1 cup of water. Mash the bark up, pour the mixture into a pot, bring to boiling and remove from the heat. Strain the mixture, let the mixture cool before application. You can apply this to your skin like a mask a few times each day. Let it sit on the affected area for about 20 minutes and then rinse off. Basically, the tannins help remove irritation. So using witch hazel can help a lot uh, with the healing process. Next slide. Aloe Versa. Aloe Versa is a plant known for its healing properties. Although it's natural anti-inflammatory, it may cause dermatitis. So it's important to do a skin patch test before application. By skin patch, I mean try it in a small sample and make sure that you don't have dermatitis because of it, and then apply it to the infected spot. To do a skin patch test, simply apply a small amount of the product to an infected area of skin. If you can, apply to the inside of your forearm. If you don't experience any irritation within 24 hours, it should be safe to apply to any hive. You can apply topical aloe versa to your hives as needed. likely a few times a day. Be sure to follow an instruction of the pack. Over-the-counter options. Home and natural remedies aren't enough to help your hives. Over-the-counter treatments may be your best fit. Not only OTC options relieve itching and irritation, they can target your body's histamine response, which is what causes the hives to appear. So these things can not only be used as treatment for the hives, it may also um, target the histamine response and reduce the cause in the first place. Calamine Lotion. Products containing calamine can help relieve itching by cooling your skin. You can apply calamine lotions directly to your skin. Make sure you mix the lotion before using it by shaking the container. Put some calamine lotion on a cotton pad or cloth. Apply the pad or cloth directly to the hive and let it dry. You can treat the hive with calamine lotion as necessary. Diphenhydramine, also known as Benadryl. This oral antihistamine can reduce the rash and other symptoms like itching by working from the inside out. Be sure to follow the dosage instruction on the package. Benadryl usually kicks in within an hour, and you should see symptoms reduction the same day. This is another type. This is oral medication, unlike the others in which you put it on the outside of the hive. This works from the inside out and reduces the histamines. Fexofenadine, Loratadine, and Cetizerine. These antihistamines typically come in 12 or 24-hour formulas to provide extended relief. They're also less likely to cause drowsiness than diphenhydramine. You may need to adjust the dosage to effectively treat hives, so talk with your doctor or pharmacist. They can advise you on how much to take and how often. Prescription options. If you're experiencing severe or chronic hives, prescription medication may be necessary. Talk to your doctor about symptoms and how you can find relief. And we will talk more about prescription options. And these are for more severe cases. Usually, normal hive conditions don't require prescription options. The first one is prednisone. This corticosteroid is taken orally. You should only use it for a short period of time as directed by your doctor. It can have side effects, especially if taken for extended periods of time. Some side effects include elevated blood pressure, elevated eye pressure, glaucoma, swelling, and weight gain. So these are for really extreme cases because they can have extreme side effects. So these are not recommended for regular cases. Long-term side effects are also cathartics, high blood pressure, reduced hormone release from the adrenal glands, poor immune response to pathogens, so you can get infections easier, thinning skin. To reduce side effects, take oral corticosteroids at a lower dose and transition to corticosteroid cream from your doctor's supervision. Again, these are for extreme cases. Dapsone, this antibiotic is available topically and as an oral medication. This medication can treat inflammation caused by hives or other skin conditions caused by bacterial infections. It's important to take all antibiotics prescribed. So, as Rayan said, the hives can also be caused by bacterial infections. So, taking an antibiotic would help in those cases in removing bacteria, killing the bacteria. Leukotriene-Receptor Antagonists. This non-steroidal treatment option is taken orally. These drugs should be used only after steroid treatment, and antihistamines have been unsuccessful. Common side effects include headaches, stomach upsets, cough, and low fever. Omalizumab. This medication must be injected under the skin. This option is only available if your hives have lasted for months. Common side effects are headaches, dizziness, inner ear pain, and cold symptoms. When should you see the doctor? Um, if symptoms worsen or last longer than a couple of days, see your doctor. They can identify the cause and provide you with medications to help relieve symptoms. Understanding what caused the hives is key to preventing future outbreaks. So basically, hives are not that dangerous. They go away after a day or two. The only cases in which you need to go to the doctor is if it lasts long, or if it's hurting, or if you're having problems um, breathing. Anything that is over the top you should seek a doctor. But usually it's going to go in 1 to 2 days, and with natural or home remedies, um, it can easily go away. So it's not that serious of a disease. And
Okay, here's the end of the presentation. Thanks for your attention.